Good morning, and thank you for joining us as we demonstrate the extended 1112. The purpose of the extended 1112 is to detect calculus, both supra and subgingivally. The type of stroke that we use with the extended 1112 is an exploratory stroke. When you are using the extended 1112, you are exploring, and I should be able to walk up behind you and take it out of your hand. This is called a light pen grasp. If you are using too much pressure, you will not be able to adequately detect the calculus deposits, and you will cause fatigue to yourself. Also, ensure that you are at the same clock position as where you are scaling. So if you're doing a surfaces towards, you'll be at 9 o'clock, and if you're doing surfaces away, you'll be at 10 to 11, just as when you're scaling. As far as the end selection, when you're working on the posteriors, let's first demonstrate the terminal shank. So this is the terminal shank here. You want to make sure that that is parallel to the tooth. So this would be the correct end selection here. If you chose this end, making the terminal shank parallel would go into the patient's ear or into their mouth. So this would not be the right end selection. So making sure the terminal shank is parallel, that's the right end selection here. You want to start mesial to the mesiofacial line angle, standing up on your fulcrum, rolling, going into the distal, going into that cull, and then safely backing out. Then you want to start distal to the distal facial line angle, making sure that your instrument stays in the sulcus, rocking up on your fulcrum, and going into the cull, and then safely backing out. Now let's move on to the anteriors. So now we're at a surfaces away, so you want to retract the lip here. This would be the correct end selection for surfaces away. You can see the terminal shank is parallel and the handle is going towards the direction that you'll be working. So that would be the correct end selection. This here would be the wrong end selection. So you want to start across the midline, standing up on your fulcrum. And on the anteriors, the width is so minimal that you have to start rolling and standing up on your fulcrum right away. Otherwise, you can cause a tissue tag, which would cause trauma to the patient. So go into that cull, feel for the calculus, and then safely back out. Any questions?
Now, Lauren, RDH.